What's going on, guys? We are here with Dr. Shawn today, and we're talking hip pain, and he's going to walk us through how to alleviate that. If we were with him in person, and for all of you at home, he's going to give the prescription for you to do as well wherever you are at. So without further delay, let's get to it, my man.
Thank you. A lot of people have hip pain. The main place they're going to feel the hip pain is right in the front of the hip. And a good way to assess this, Jeremy, I'll have you lie on your back. I'll have a patient lie on their back and I'll literally rotate their hip in and feel if one hip isn't moving as well as the other or if it causes pain right in front of the hip. So from a chiropractic standpoint, the way I can help that, Jeremy, slide over this way for me. I can actually distract his hip. And the way I do that is I put his leg in between my leg and I'll traction that leg out and then thrust. And I'll feel a nice gap right there. So I'll literally decompress that hip to take the pressure away from the spot causing that pinch and that pain.
All right, guys, we're going pigeon stretch here from an elevated position, which is one of Shawn's prescriptions. Now, when I typically do it, we're talking, for the glutes because the low back is tight, which is a little bit different. So when I come up, because I own the mobility, I typically would come down and squeeze it here, which makes my ass literally just light up in seconds. But for you and for the hip, it's a little bit different. Is that right?
Right. So one thing I want patients to avoid is that when they come down, they just don't simply sink into it. What that's going to do is jam the femur in the socket and create that pinch. So what Jeremy can do is literally step away, keep the knee down, and then bring a long arc into it and then bend forward so it doesn't jam the femur in the socket. It'll create more length in the glute and decompression in the hip.
Easy enough.
Okay guys, so the second prescription for hip pain or hip impingement is lateral band walks. I like to have the band at the ankle. You can also bring it above the knee. And what you'll do is you'll tuck your butt under, step away, slowly bring this foot back in, step away, this foot back in. I like to go 20 yards one way, 20 yards back. Really keeping control of this foot as you come back. It's going to create strength here and ultimately allow your hips to stay out and not impinge in that socket. Okay, third prescription for hip pain or hip impingement, I like to use the air squat, but an air squat with a resistance band below the knee. And when you're going to squat down, you want to make sure that your knees travel over your outside part of your foot. To demonstrate, we're simply going to squat down, allow the resistance, holding the knees out, and as you come up, keep the knees out and squeeze your butt at the top.